My name is Dr. Samir Bangalore, and I'm the Medical Director of the Epilepsy Center at TriStar Skyline Medical Center. This video is an introduction to the Epilepsy Monitoring Unit, also known as the EMU, and I just wanted to give you some information about what your stay in the EMU would be like. The EMU is a specialized area of the hospital where we electively admit patients in order to analyze their brain waves and treat them for their seizure disorder more appropriately and hopefully bring them to seizure freedom. So while someone is admitted to the Epilepsy Monitoring Unit, we use EEG, a set of electrodes on their head to analyze their brain waves, and we pair that with audio and video recordings, the goal of which is to record seizures and again try to devise a better plan to treat their seizures. So while a patient is in the Epilepsy Monitoring Unit, we use several techniques to actually provoke seizures. Again, the goal of bringing someone in the hospital for this type of testing is to make them actually have a seizure so that we can figure out where those seizures come from in their brain. Some of those techniques include tapering them off of their anti-seizure medications, and then using tools like strobe lights or hyperventilation and sleep deprivation. Those are some powerful triggers for seizures for a lot of patients that we utilize in the Epilepsy Monitoring Unit. Typically, we admit patients to the Epilepsy Monitoring Unit on a Monday, and a stay lasts between 3 and 5 days. The Epilepsy Monitoring Unit rooms are hospital rooms with a hospital bed, a couch to sit on for the patient or their friends or family, some other seating, and a private bathroom. The intent, again, is for someone to be very comfortable in the room, almost like they were living their normal life, but in a controlled setting where we can provoke seizures. When patients come to the Epilepsy Monitoring Unit, we want them to bring all of their medicines and supplements in the bottles with the pharmacy label so our nurses can check them over. Once you arrive, don't take your own medicines. Our nurses will distribute them to you. We also encourage you to bring books, laptop computer, video games, whatever materials from home will keep your mind occupied and make you as comfortable as possible. You can also wear whatever clothing you would like from home. You don't need to wear a hospital gown. We prefer that you wear clothing that buttons in the front so that we can put chest electrodes on you. Besides that, you can wear whatever you'd like. And friends and family can also bring materials that you need once your stay has already begun. Before you come to the EMU, make sure to wash your hair well and do not use hair products because, again, we will be applying electrodes to your scalp once you arrive. On the day of your admission, you should arrive and go to the first floor main entrance registration desk, which is adjacent to the statue of Dr. Frist. Once you get there, our EMU coordinator will meet you and bring you to the Epilepsy Monitoring Unit. After someone's admitted to the Epilepsy Monitoring Unit, they should not leave the room, so you cannot smoke or vape, and you cannot use alcohol. It's just part of our safety protocol. If there is a patient who uses those products and may go into withdrawal, you should notify our nursing staff because we can help use medicines or other techniques to prevent withdrawal. When patients are admitted to the Epilepsy Monitoring Unit, it can be an unfamiliar place, and it is very helpful for family members and friends to come visit and even stay overnight. I strongly encourage family members to stay overnight so that if a person does have a seizure, they have a familiar face that's there to provide some help and allow us to better care for the patient. The friend or family member who stays during the daytime or overnight will have a sleep bed provided with bedding, again, to keep that family member comfortable as well. When someone is admitted to the Epilepsy Monitoring Unit, they're not on a restricted diet the way other hospitalized patients are. You can bring whatever food you'd like. We have a fridge and a microwave for you to store and heat your food. If you have visitors, they can bring food as well. And again, the goal here is to make you as comfortable as possible and resemble the sort of diet you'd have at home and not introduce a new variable with regard to what you eat. On the first day of admission, our technologists apply EEG electrodes to your scalp. We also perform blood draws for routine blood work, and we apply an IV catheter to your arm. The reason for the IV catheter is so that we can give you medicines intravenously should the need arise. During the hospital admission, we'll get a lot of data regarding someone's seizures. We use that information to devise a treatment plan, and at the time of discharge, I go over that treatment plan. It might involve resuming medicines or changing them. That all happens at the time of discharge. Following the completion of your stay in our EMU, you'll follow up with your neurologist and go over the results of the study, and again devise a long-term plan which may involve medicines, it may involve surgery, it may involve other techniques, and that will all depend on the findings from the EMU stay.